So here we are again, going to be questioning Mark Axel on the feedback from the Q1 Staff Friends and Family Test. And I've been joined today by an OT, Julia Bingham here.
Hello.
Thank you for helping us, Julie. It's nice to have a clinician cross-examining the CEO alongside me. We're going to obviously focus on some of the challenging feedback we've had, but I would like to put this in context. 2/3 of all the comments were absolutely very positive, but obviously you don't want to hear us just patting ourselves on the back. You'd like to get Mark challenged on film, so here we go. Obviously you've looked at the results, Mark, and the feedback. Any comments you'd like to make before we start asking the questions?
I think firstly I'd just like to say thank you to everybody that took the time to fill out the Staff Friends and Family Test. The feedback's really important. As Michael knows, when the Staff Friends and Family Test comes in, the staff survey results, I do look at them really closely and I do read all the comments, because actually the value is in some of the feedback that you give that's written, because then you can understand the results a bit better. So thank you to everybody that fed back. It is great that a lot of what you've said is positive, but we shouldn't be complacent. And for me, the opportunity to do these sessions are really important. And it's great to have Julia here, somebody from the front line, to ask the questions that matter so that we can answer them honestly and reflect on what we need to do as an organisation to address some of the issues that you're going to raise.
Thank you. So I think we'll start by talking about culture. And I have to say the comments generally around the culture in the organisation are very positive, which is good for me as engagement lead. And particularly from new members of staff especially, they generally say they haven't worked anywhere as good as this. But it's clearly the case that in some areas culture does continue to be an issue, and some staff are still expressing dissatisfaction, both around management cultures and colleagues' behaviours, and that these are not being addressed. Have you any thoughts or comments on this and how we can get it across the board into a good place?
I think I need to be really clear that I have an absolute zero tolerance to poor behaviours and bullying and harassment that people know well. We never stop working on this, and over the last 4 years we've done a lot of good work around trying to improve this, trying to create the trust, make the trust a more open place to be and for people to raise concerns. But I know still that potentially there are still pockets in the organisation where we still have behaviours that we wouldn't expect and are not in line with our values. What I would say is I'd encourage anybody to raise those issues, and they can raise them with you, Michael, they can raise them with myself, their manager, their executive director, because quite often people in the surveys will comment that this is still an issue, but actually from our level we're not able to pinpoint it and say where it is, because we have to remember that a lot of these comments are anonymous. Mm-hmm. So the message I give to all staff is, if you are concerned or you feel that you're experiencing behaviours that aren't in line with our values or mean that you're not able to work effectively, enjoy your work or deliver the quality of care that you aspire to, please raise it, and we will support you to deliver a plan that addresses that for you in a way that's supportive to you and improves what we need to do. And in the next couple of weeks we'll be publishing a really good example of a team that have raised a concern and how they were supported to address those concerns, and it's a real example from the Trust. And I'd encourage people to watch that video and listen to what our staff have said about what it feels like when you do raise concerns and the positive outcome we can get. Because I do want to address it, I do want to take action, I do want to support as many colleagues as possible, but people have to raise it first for us to be able to address it.
Mm-hmm. Absolutely. Thank you, Mark. Julie, I think you've got a question now you'd like to ask, particularly pertinent to you.
I have. It's not my question, I have to say. Clinicians such as OT staff and nurses have no voice. This is a comment that's been left. Despite being accountable for their own practice, issues around MDT not working in practice.
So if I take this in two parts,
Yeah.
One is about the clinical operation of the Trust, and the other one then is about the professional voice of therapists and nurses within the organisation. So the clinical operation of the Trust, as an exec team, we've been looking at the effectiveness of MDTs for a little while now. And as a result, we've issued some very clear guidance around how MDT should operate that do embrace that everybody has an equal role in that MDT discussion.
Yeah.
Because we need service users to go on and recover and live as independent lives as possible, and we all have a contribution to make to that. And it's something we're going to watch very closely over the next couple of months to make sure that the actions that we put in place around the MDT do start to gel and do start to take effect, so that we are getting a balanced voice in the MDT around what's the right treatment process for service users. And that's based on feedback we've had already. So the comments that were in the friends and family test built on that picture that we were looking at as execs. And I would encourage that if people after the next few weeks and months are still feeling that it's not improving, that they raise it and we'll address it. The other bit then is about the professional voice of therapists, and we were just talking before we started this about your training and how you want to make a difference. And as an organisation, we're really clear that we want to make sure that the professional voice of therapists goes right through the organisation to the very top. So we've set up a clinical senate, which is a group that's now been operating for about 2 or 3 months, that reports to the board, that advises us on clinical change, ideas, potentially service redesign. And when we set that up, it was really important to me that every professional group in the trust had representation around that table. So therapies have a big part of the voice around that table. So that is about then each of the professions advising us as a board on the right things to do with our services as we develop them. But connecting the two is really important. So we may have one working really well but not the other, but we need both to be working really well. So Mark, who's our medical director, and Rosie, our nurse director, chair the clinical senate, so I know they're overseeing that process. We put some measures in place to try and improve the MDT and make sure that it is a true MDT approach, and we'll continue to watch that, and if it's still not delivering the actions that we would expect, I'd ask colleagues to let us know that.
Do you think that perception is common in other trusts? Have you had any feedback from colleagues elsewhere?
Yes, I think it is.
Yeah.
I think probably as an organisation, we have a relatively small group of therapists, unfortunately, and I think that's one of the benefits of the merger, because we know Black Country have a stronger therapy structure to it. So there are immediate improvements we can make through that. But the fact that, I know this is a challenge in other trusts doesn't mean that we shouldn't address it here.
No.
So I continue and want to push hard to make sure that our clinical voice is balanced.
Thank you.
Thank you. As ever with this feedback, staff who primarily go into healthcare because they're passionate about looking after patients do have a concern that as an organisation and as a structure, the NHS as a whole is more interested in quantity rather than quality, and that they have so much paperwork to do that they find it burdensome and tiring, and it's taken them away from what they want to do, which is look after patients. Any thoughts on that as an issue across the NHS and maybe what we can do to alleviate it?
So first things first is I have exactly the same view as the people that have raised those comments. I want the people that deliver frontline care to spend as much time as possible with service users. I think frontline people, that's the joy of the job. And we need to make it easier for staff to be able to do that. Documentation is important. We need to document what we do and how we've done it in our documentation. But our systems don't make that easy for people. So we have electronic records in community, paper records in inpatients. The current patient management system we've got is not the easiest to use, and the technology behind that is not great either. And we know we're moving towards a new electronic patient record, which means that if you're in an inpatient, you'll be able to see the care they've got in the community very easily without having to chase around and find different files in different places, that then you can form a picture about the next steps you make for treatment. That'll be the first stage of a process with the implementation of the electronic patient record. I think the next stage we then need to go on to is consider and increase how we use digital better. So a lot of staff tell me that they don't know how to use IT, but yet I know a lot of staff use smartphones.
Yeah.
I think the issue is that we give you systems that are just not naturally easy to use and are time consuming or are slow. Broadband and Wi-Fi is a really good example of that. So improving our digital offer so that you can do things when you're with the patient on the ward or in their home or in the clinic, that is quick, easy to use, easy to follow, and it's done once. So you don't have to write it up 2 or 3 times, will help to reduce that burden. We know that the acuity of patients is increasing, and it's something we look at regularly as a board. And we know that caseloads are rising in our community teams, and that, again, something we're reviewing regularly. Because quality is our priority. I know we ask you to do a lot, measure a lot of things, but nationally that's the nature of the beast that we have to feed. But quality is our priority as a board, and we do look at staffing levels regularly, and we do look at caseloads regularly, and if we need to make changes, we will do. So I do recognise it as a challenge, and it's something we're constantly looking at.
Mm-hmm. Thank you. Violence and aggression.
Yeah.
It's a perennial problem for all NHS trusts, perhaps worse in some of the acute trusts. Obviously there's violence and aggression from patients, but also members of the public, family members and other visitors. There's a concern, quite a specific one here, around working in that environment and the concerns that brings, and also having to continue working with people who have actually already been violent or aggressive towards you. I know there's some work going on around this. Would you like to elaborate on what we're doing and what our attitude should be to aggression in the workplace?
So we've been doing a piece of work with NHS Improvement, who are regulators. There's a national programme at the moment around looking at how we handle and manage violence and aggression. We know it's an increasing area of concern and something we're watching closely, and we are using the programme to learn best practice from other organisations, share our own experiences, to try and address how we reduce the incidences of that happening. I think the next stage for us as an organisation, I was reflecting on this just recently, is we need to be more visible about what we tolerate in this organisation in terms of those behaviours. If you go into an acute trust, you will see very clearly that signs up that describe that they will not accept certain behaviours, aggression towards staff. And I think for me, once we come through the campaign we've got at the moment around going smoke free on the 1st of September, I think we then need to look at how we make it more visible to service users and their families what we accept and what we don't. Because if you go into our outpatients, it should be there. It should be clear for people to see that we are supporting our staff, we want to support our staff, and we want you to have the best possible interaction to make sure we give you the best care. And quite often these behaviours get in the way of that, and it's not a good experience for either party. So we'll take the learning from the national programme into what we do as an organisation, but in the autumn I want us to get more visible in our services and our buildings about what we do and don't accept.
Yeah. And having done a lot of the work on actually talking to staff around this and interviewing them, I think generally the staff were very understanding of the conditions our patients are in, and were very forgiving and very appreciative of that they are facing a very challenging situation. But they are quite adamant that from the perspective of family members and members of the public, we should move towards a zero tolerance approach on that, because they don't have any reason or justification or mitigating circumstances.
And I would agree with that, and I think that's probably the next stage we need to take with that particular piece of work.
Thanks very much. We're always encouraging people to incident report, and we've got a comment here that people have raised incident reports in the past, but they don't receive feedback or support or supervision. What should we be doing better to close that loop?
Okay, so incident reporting is a really important part of our culture, and incident reporting goes right to the very top. So people may or may not know that 9 o'clock every morning I get an email into my inbox that lists all of the incidents from the previous day. So if you raise an incident, it does get, all of the execs get to see that, so don't think it just goes into a system and doesn't get looked at. And I read them every day, and it gives me an idea of where the challenges are and what the issues are that staff are facing and the potential challenges we need to address as an organisation. And if they are urgent, we will act on them very quickly as execs. I can list numerous examples where we've seen an incident in that report, and whereas execs, we've gone, literally picked up the phone to each other and said, we just need to do this, and let's get it done. We are making improvements around feedback at the moment. That's more around serious incidents. So we have a new serious incident process that is aiming to feedback more regularly on lessons learned or themes from those serious incidents. The next stage of that programme will then to be to do the same with incidents.
Mm-hmm.
But obviously, as you can understand, we have focused with serious incidents first because they tend to be quite far-reaching when they happen, and the lessons learned can impact more than one service.
Mm-hmm.
But the next stage will be then to move to how do we start to feed back on incidents, because we want you to raise them, and we do need to respond to them, and be assured that work's going to happen. But our focus at the moment is on just making sure our process is right around serious incidents.
Great, thank you very much. Some questions around staff in general now. One from you, Julia.
So as a mental health trust, we also need to encourage staff with their own mental health problems to talk, seek help, support, and find treatment if appropriate. Ironically, staff may feel that they cannot disclose that they have a mental health problem. What can we do to address this?
Okay. There are two parts to this. The first one is how do we give managers, and some of our managers are non-clinical, we have to remember, the skills to identify that a member of staff may be suffering with mental health issues if they're not coming forward with it. So there's a piece of work we're doing at the moment to support managers to identify that. There's then also the issue of, I think it's our top two reasons for sickness in the trust are musculoskeletal issues and stress and mental health issues. That second one can't be right for a mental health organisation. And so we are at the moment developing a proposal where we have a dedicated unit to support staff with their mental health issues. That's been developed by one of our clinicians. He came to our executive team meeting that we have regularly on a Monday morning and proposed his idea. He actually raised it at team brief. I thought it was a fantastic idea, and I got him along to execs. That's been worked up at the moment. Not all staff will feel comfortable being treated in their own organisation. So what I'm trying to set up, or we're trying to set up, is a reciprocal arrangement. So if, say, for example, a member of staff in our own organisation is experiencing mental health issues, but doesn't want to be treated in his or her own organisation, that maybe they could access that service from Black Country or Birmingham and Solihull, and we can do the same for them. And that proposal's is in train now, it's nearly concluded. And I'm really clear that we will identify the resource as long as the proposal's right to do this, because it's not a good experience for our staff. We know that we have in some areas of our service particularly small clinical teams, and when people are absent from work that creates more pressure, so it has a knock-on effect. But I absolutely agree that there is more we can do to support our own mental health, so that's the plan. And I would hope by October, November that we're able to say that we're starting to set this service up.
I've got another question here. A concern was raised about lack of progression and development and talent management, particularly highlighted within admin and nursing. And there was a comment left that says, I feel undervalued as a nurse at the current time and demotivated. And for the last few years, the main focus of the trust has been on the merger. Nurse progression is limited. To move past a band 6, as you then have to be a manager or a clinical lead with managerial responsibilities. So where is the incentive to stay as a nurse? Nursing pay is inadequate for the job and the responsibility we do. I have been told that wages are national, but nurses are leaving faster than they can be replaced. So why as a trust are we not offering any financial incentives to keep and retain our nurses and encourage nurses to stay as nurses?
Okay, let me pick that up in some broad sections. So firstly, the pay terms and conditions are set nationally.
Yeah.
I think there's two parts to this, and the first point you raise about career progression, I think it's a challenge for actually virtually every profession in our organisation. And whether it be a nurse or whether you're working in HR, we are a small organisation and our teams are quite small, some of them. And unfortunately, there is a point, and I see it quite regularly, where people get so far into their career and then leave the organisation because they want to make the next stage. So they go from band 5 to band 6, and maybe we don't have a band 7 role, so they go somewhere else. And I can think of numerous examples where I've seen that individual 2 years later and they've come back. Quite a few examples. There's sometimes with the conversation we'll go, I thought you left. And one of the advantages, and I know that the comments that are in there about the merger, is as we come together with Black Country, we have the opportunity to have bigger teams. One of the advantages I think that we need to harness around this is that will create greater opportunities for career progression. That, you know, we will be able to set up structures where you can see a career progression and a development programme to you that takes you from band 5 right the way through to, you know, I'd love it, I've always said I'd love it as somebody to become chief exec for the organisation that's come through the organisation.
Julia, that's your career progression.
We'll see.
So they come from band 5, band 6, and they continue to progress with us, because I don't want good people to leave. And I do genuinely believe that is one of the benefits of the merger, that we'll have larger and more resilient teams, that we can create those opportunities. In terms of the pay terms and conditions, then they are nationally set, but there are things that we can do that make us stand out as an organisation. And make us attractive as an organisation. Some of the feedback that you've given from the staff's friends and family test tells us we're doing some of the right things.
Absolutely.
But there is more we can do. A good example is what I've just described to you around making sure that we've got the best health and wellbeing support for our staff. We've looked at and just recently implemented the opportunity for staff to buy annual leave. So if people want...
I have heard that.
Yeah, so because we recognise that works for some, not all, but it works for some. And we have Sam Skelding, who's our health and wellbeing coordinator, that's looking at numerous different programmes to support that, because whilst we are set by national terms and conditions, if we can offer a more rewarding package around it, then people will stay with us. So that's what we want to do more of, and the annual leave, the mental health support to staff, some of the work that Sam's doing is just part of that. And we want to keep developing that. So if people have got any ideas about things that would work, you know, and they can be financial incentives, but also things that you'd like more of in the trust, then please let us know and we'll look at them. Because quite often the best ideas do come from the front line, and I'm really passionate about implementing them if they do.
I really loved having an ice cream the other week. Honestly, when it was so hot, I was just really chuffed about that.
And I was gutted I was not in the office on that day.
Oh, well, there you go.
But that's
Snooze, you lose.
that's a doing the right thing approach, and part of our culture is that we can do that stuff. And I'm glad people appreciate it, because it's appreciated by us that, you know, not just on hot days, but any day, what you all do. And the opportunity on that day was just there to do it, so I'm glad it was appreciated. I never got an ice cream, interestingly, but that's fine, I'm not going to mention that, but I'm glad people appreciated it, and that's what we want to do more of, because that's what makes the difference, because you spend a lot of time at work. You do. And we all spend a lot of time at work, and it's the environment and your colleagues that make the difference.
Thank you.
There's a couple of related points here. One is around the fact that while most people do think we're still doing a good job and delivering good treatment and it's a good place to work, they don't feel we have a lot of resilience and a lot of depth to our teams. They are very lean. There's not a lot of give there if someone's off sick. And related to that, because it would impact on it, people are concerned about the ability to access information and communication. And the example they give is, we're encouraged to attend team brief, but the challenge is if they can get there, and it's very difficult to get there, particularly for frontline staff. And you discussed already how one person going to team brief with a good idea is now running with that and developing a new service. That's how effective it can be. How many people have we not been able to reach, and how can we address that challenge of reaching the talent and ideas and thoughts and opinions of everyone?
Yeah. So let me pick up the first point, which was around small teams, wasn't it, and resilience. I recognise that challenge. That resilience can be tested by people leaving, by people going off sick, by caseloads, and it's something we continue to look at and develop as we start to develop our clinical model for mental health at a Black Country level. And I think I've explained in my previous answer about some of the benefits of having larger teams that will give. The bit about communication is something that I think about a lot. So I would love it if we had the ability to have a conversation with everybody in the organisation. And we've tried various things with team briefs. We've tried moving times so that they don't clash with patient meal times or ward rounds or clinic MBTs, etc. We've tried extending the venues to do more community venues, but we didn't get the turnout that we were expecting. And we do different things. So Wednesday Why has now changed thanks to the great work of the comms team. That's more informative. I do a message every Friday that kind of talks about some of the themes that are going on across the organisation. And I'm really open to suggestions on this because I do want as many people as possible to be putting ideas forward, helping us to achieve great things. And if there are ideas that people think will work better, so team brief, we encourage one person from every team to attend. And they're planned throughout the whole of the year, so the dates aren't, they're there. And as long as people feedback, that might work. But if there are other suggestions that we can do something differently, we've just set up a Facebook group, a closed Facebook group for staff to join. That is another way we're trying to do it, and that doesn't work for some, I know, but we're open to suggestions because I think it's something that challenges all organisations about how do you get messages out to everybody. I was in catering at Bushy Fields just a few weeks ago, and some of their team don't access emails. One of the suggestions I've heard is about, do we attach team brief to payrolls, pay slips?
Yes, mentioned here.
That's a possibility, but our pay slips aren't produced by us, they're produced by an external provider. So if there are ideas about how you could do better we could do better communication, let us know. And I think the other thing and I always say this, is if you want to have a chat with the exec team, just invite us.
Yeah,
Any of the exec team will happily do shifts with you. Any of the exec team will come and do your team meeting with you. Julie, I'd love to shadow you at some point and see what you do. So just invite us and we'll come along and we'll have a chat and we'll talk about what's going on in the trust.
Well, you can't get there often than that. Although I will notice that the fact that you could buy holidays seemed to get around the trust really, really quickly, and everyone knew about that within 24 hours. So maybe sometimes it's what the message is, and how interested people are in it. A final question then, and this is really around infrastructure and resources, and the impact that some of the ageing buildings people work in and the poor facilities, cramped facilities, lack of parking or IT or whatever we've already talked about, this does affect people's morale. Any prospects for a huge splurge of cash in the new trust? And I'm setting you up there for the fall, I do apologise.
Thank you, Michael. We have a programme that stretches over a number of years to improve the buildings that we've got and spend an enormous amount on IT. So that will stretch over 3 to 4 years, will include the electronic patient record that I've mentioned, improving our digital offer, but also making sure that we continue to refurb all of our clinical areas. So that programme will roll over a number of years. And there are some buildings in the trust that we know we need to replace. So the very high profile example is Bloxwich Hospital, where due to the value of it, we need to get external approval to be able to deliver it, and we're still pushing hard on that external approval at the moment. So it is very much at the heart of what we want to do as a trust. The business case has been written for the merger. It's absolutely at the heart of that because Black Country Partnership are just as challenged as we are in some of their environments and buildings. So it continues to be something that we want to move forward. People will have seen examples we've done already. So the refurb of Clee Ward is a really good example. We want that to be the model, as long as it works for clinicians, that we roll out across all of our wards. So there is a programme in place, and I'm sure we can describe and share what the themes are in that. The other element to then is, and how do we make sure that when things get broken, they get replaced really quickly? And that's something we've not quite cracked yet. It's something that we're working on. So if you have an IT problem, how do you get it resolved quickly and efficiently? And if you've got an estates issue, how do you get that resolved quickly and efficiently? And that's something that Rob Pickup, who's our Director of Finance and has responsibility for estates and IT, is looking at the moment, so that we can have support services around our clinical teams that are responsive to those issues.
Excellent. Julia, any final comments?
I can't think of any.
No. I'll say thank you very much for coming along and being a voice of the clinical teams here to talk to Mark. It's nice that it's not all fallen to me. I think you're a natural, so if you want a job,
Yeah.
that was almost no breaks in take there at all.
I'm quite happy where I am, thank you.
Okay, fair enough. I'd like to thank you as well, Mark, for giving up your
Welcome.
time. I'd like to say to everyone else that if you've watched this and enjoyed it, please note that next week, from the 27th of August, we're doing the next Staff Friends and Family Test for 2 weeks. So those people who were talking about communication, that's an ideal opportunity to give us your feedback again, and we can do another Q&A with Mark. We're also asking staff in advance of the merger to comment briefly on their Room 101 thing and their suitcase thing, which is what one thing would they like to dump into Room 101 when we go into the new trust, and what one thing about Dudley and Walsall would like to pack up in their suitcase and make sure they take with them, be that a process, a behaviour, a culture, whatever it could be. It's entirely up to you, but we just want feedback on what you'd like us to leave behind and take with us. And a final pitch, because it's when I'm busiest, October, November this year is a main staff survey running for 2 months. It takes about 15 minutes of your time, whether you're doing it on paper or online. And in terms of feeding back and getting your voice heard, that is absolutely the best way to influence both what we do now and in the future. And particularly going into a new organisation, it would be really fantastic to have a really, really strong Dudley and Walsall voice going into that. So that helps mould where we are in 12 months' time, 24 months' time. So please do that. Also, it makes my job easier when it comes to appraisal time.
Can I just add that the Friends and Family Test, the staff survey, I do look at them closely. There's any board, we look at them closely, so the feedback is really valued. And as we go through each of those, please do take the time to fill it out and feedback. But equally, if you've watched this video and you've got a burning question you want to ask me or one of the exec team, or you want to challenge me on something, please do. My email address is in the address book, and as people will know, I do respond to emails directly. So if you've got a question you want to ask on the back of this email, then just get in touch.